He was top in his class for both O-levels and A-levels. Mr. Macharia is our nominee for Cabinet Secretary, Ministry of Health. Karibu Bwana Macharia.
As soon as the president called out his name and stated the cabinet docket which he believed James Macharia would competently manage, doctors frowned. Today, the Kenya Medical Association called for a general meeting to, among other things, deliberate on this latest development, where a certified public accountant with a master's degree in business administration is likely to become the health cabinet secretary if Parliament approves his nomination.
We are not against the president's decision to nominate the gentleman he has nominated as a cabinet secretary. And we have pointed out that we respect his professional qualifications, a highly qualified individual. The only problem is the docket. So I do not think we can tell the president, the parliament to reject him. The president still has an opportunity to redesignate him, and he's allowed to do that. And Parliament has an opportunity to advise the presidency accordingly and tell them, yeah, this is a good person but can be placed in another docket.
We have many people in the health sector, very senior doctors, professionals, who have proven themselves in terms of holding positions and making a difference in this country. And then the other issue, we don't understand why it is only the health ministry where you always constantly bring an outsider. When they look for nominee for foreign affairs, they got somebody who's actually been working in that sector. When they look for treasury nominee, they've looked for somebody who's been working in that sector with proper qualification.
Never mind, the country's biggest referral facility, the Kenyatta National Hospital, has been transformed from a moribund institution into a self-sustaining, profit-making public healthcare institution under the leadership of Richard Lesiampe, who was plucked out of a 16-year-long career at the Kenya Wildlife Service, where he had risen to the assistant director's position. It appears the thinking that went into appointing Lesiampe, an outsider, has gone into the nomination of James Macharia as well.
I think we all need to accept and to understand that at the level of Cabinet Secretary, what we're looking for are managers and individuals who are capable of implementing the agenda that we have.
But my point still stays. If you combine somebody who has technical knowledge in the sector that they're going in and managerial skills, they do much better than if you bring an outsider just because they've got managerial skills.
Because research from everywhere else in the world has shown that insider managers, people who have technical expertise as well as managerial expertise, perform better than people who have only managerial expertise who are brought into an industry to manage it. So this is something that is best practice from across the whole world.
Doctors are agitating for one of their own, but they are stating that it is not for selfish reasons. They are concerned about the health indicators, which they say have been worsening over the past 2 decades. They say no dent has been made on the child and maternal mortality rates, meaning that the rate at which mothers die while delivering and children under the age of 5 years dying is still unacceptably high. That, coupled with an acute staff shortage problem that is crippling the sector, they say the docket cannot afford to have someone who would still need time to understand the dynamics.
There are technocrats, but the government of the day provides the policy background. If you're coming in to provide a policy background and you do not know what happens in that particular ministry, it will take you a very long time before you are in a position where you can comfortably discuss policy issues.
I think we are really choosing on the basis of individuals who do have that management capacity to work even with those individuals who operate within those sectors and to be able to deliver results for Kenyans. So
the disgruntled doctors may just have to be content with an outsider, despite the extensive lobbying for one of their own. Sylvia Chebet, Citizen Live at 9.